Let's check the key parameters of ABG analysis. First parameter is pH, that is the potential or power of hydrogen ions. It measures the blood's acidity or alkalinity. Normal arterial blood pH ranges between 7.35 to 7.45. If the pH value less than 7, it indicates acidosis, and if greater than 7, it indicates alkalosis. As the pH value decreases, concentration of hydrogen ion increases. As concentration of hydrogen ion increases, the solution becomes more acidic. That's why lesser pH solution becomes more acidic, because pH is the negative logarithm of hydrogen ions. Next parameter is partial pressure of carbon dioxide. The normal range is 35 to 45 mm mercury. It helps to assess the respiratory function. How? It reflects how well the lungs are ventilating or removing carbon dioxide. Partial pressure of carbon dioxide is the pressure exerted by the dissolved carbon dioxide in arterial blood, where CO2 is a byproduct of metabolism which is eliminated through lungs during exhalation. Hyperventilation occurs in conditions like anxiety or pain. There is excessive removal of carbon dioxide. So the concentration of dissolved carbon dioxide becomes low, so it results in low PaCO2. And in hypoventilation, in conditions like COPD, respiratory depression, inefficient removal of the carbon dioxide. So dissolved carbon dioxide concentration or pressure increases, so it results in high PaCO2. Let's see the role of carbon dioxide in acid-base balance. When carbon dioxide mixes with water, form carbonic acid. And the carbonic acid dissociates to form what? H plus and HCO3 minus. So, hydrogen ion concentration determines the acidity of the blood. So, what will happen when CO2 concentration increases? H plus ion concentration increases. When H plus ion concentration increases, what occurs? Acidosis occurs. Next parameter is bicarbonate with a normal range of 22 to 26 mm mercury. It reflects metabolic or renal function, as kidney can reabsorb or excrete bicarbonate depending upon the acid-base imbalance. Saturation of oxygen is the next parameter. It is the percentage of hemoglobin saturated with oxygen, and the normal range is between 95 to 100%. Next is base excess with a normal range -2 to +2 millimoles per liter. It helps to assess the metabolic component of acid-base imbalance, that is metabolic acidosis and metabolic alkalosis. Positive base excess indicates metabolic alkalosis, whereas negative base excess indicates metabolic acidosis. Let's take the steps in ABG interpretation. First, measure the blood's acidity or alkalinity by looking at pH. We know that the normal range is 7.35 to 7.45. If it is less than 7.35, it indicates acidosis, and if it is greater than 7.45, it indicates alkalosis. So now we got whether it is acidosis or alkalosis. Next, determine respiratory acidosis or alkalosis, or metabolic acidosis or alkalosis. If any alteration in partial pressure of carbon dioxide, it is the problem associated with respiratory system, because lungs are excreting carbon dioxide. So if abnormality of partial pressure of carbon dioxide, that means lungs are affected. So it is respiratory acid-base imbalance. And if bicarbonate level is abnormal, it is the problem associated with the metabolic system, because bicarbonate is the byproduct of metabolism. So if any alteration in the bicarbonate level, it indicates metabolic acid-base imbalances. Provided if partial pressure of carbon dioxide is increased, it indicates respiratory acidosis, and if it is partial pressure of carbon dioxide decreased, it indicates respiratory alkalosis, because if carbon dioxide partial pressure is increased, there is a chance of formation of hydrogen ion. So acidosis will occur, that I already told you. And if it is decreased, PaCO2 decrease, it indicates respiratory alkalosis. If problem is associated with the partial pressure of carbon dioxide, go for respiratory, and if problem is associated with bicarbonate, go for metabolic. Alteration in the bicarbonate level causes metabolic acid-base imbalance. Increased bicarbonate level causes alkalinity of the blood. So it causes alkalosis. What type of alkalosis? Metabolic alkalosis. And if it is decreased, metabolic acidosis. Then compensation. Two types of compensation is there. Full compensation and partial compensation. In full compensation, pH is within the normal range, 7.35 to 7.45. But PaCO2 and bicarbonate level both are abnormal. And in partial compensation, pH is not within the normal range, but one of the system, either respiratory system or the metabolic system, tries to compensate for other. If respiratory acid-base imbalance, kidney tries to compensate, because in this lungs are affected, so kidney helps. And in metabolic acid-base imbalance, lungs try to compensate because kidney is affected, so lungs are helping. Okay. And finally, assess oxygenation if saturation of oxygen between 95 to 100. Let's do a question from ABG analysis. 55-year-old male present with shortness of breath. ABG results are pH 7.30, PaCO2 55, bicarbonate 24 and PaO2 70. So first determine whether it is acidosis or alkalosis. Look at the pH. It is 7.30, that is less than 7.35. What does it indicate? It indicates acidosis. And it is not between 7.35 to 7.45. So it is what? Uncompensated. And look at PaCO2 and bicarbonate level. Normal PaCO2 is 35 to 45. Here it is 55. So it is abnormal. And look at bicarbonate, normal values between 22 to 26. Here it is 24. It is normal. So the problem with partial pressure of carbon dioxide. So well, it is respiratory or metabolic? It is respiratory. So respiratory. So what is the final result? Respiratory acidosis uncompensated. Let's do another question. A patient with vomiting for 3 days has the following ABG values: pH 7.50, PaCO2 46 and bicarbonate 30 milliequivalents per liter. What is the acid-base disturbance and whether there is any compensation? That is the question. Look at the pH 7.50. It is high, so it is what? It is alkalosis. So it is not between the normal range 7.35 to 7.45. And it is far above the normal range, so it is uncompensated also. If it is between the normal range, compensated. If it is far below or far above the normal range, it is uncompensated, or near to the normal range, it is partially compensated. Yeah, like that you have to interpret. Then look at PaCO2. Normal PaCO2 is 35 to 45. It is 46. It is normal to slightly elevated, but not elevated enough to cause respiratory acidosis. So look at bicarbonate. It is normal is 22 to 26. Here 30. It is abnormal. So it is metabolic. So we got the answer: metabolic alkalosis uncompensated. Let's see some common ABG disorders: respiratory acidosis and alkalosis, then metabolic acidosis and alkalosis. Okay, in respiratory acid-base imbalances, partial pressure of carbon dioxide is abnormal. In acidosis, it is increased, and in alkalosis, it is decreased. Then causes of respiratory acidosis are COPD, hypoventilation, and drug overdose. In all these cases, carbon dioxide buildup occurs because it is not efficiently removed. So partial pressure of carbon dioxide increased. In both respiratory acid-base imbalances, bicarbonate remains normal. In acidosis, the pH is decreased, and in alkalosis, the pH is increased. Regarding metabolic acid-base imbalances, in metabolic acid-base imbalances, bicarbonate level is abnormal. It is increased in case of alkalosis and decreased in case of acidosis. Metabolic acidosis causes are diabetic ketoacidosis, renal failure, and diarrhea. In all these cases, acid buildup occurs, result in acidosis. In metabolic alkalosis, that occurs in vomiting, diuretic use, or in all these cases, acid is removed excessively, alkali buildup occurs, result in alkalosis. So in both these cases, PaCO2 remains normal. In acidosis, pH decreased. In alkalosis, pH increased.